now do something that we haven't done today yet. We're going to have one of our patients advocate and talk about her story. And Mrs. Ollson has a chondrosarcoma, but as you know, the behavior and the histology is very similar between these two. And hers is a special story. You are now more than 9 years out. Mm-hmm. And I'll just say how she came to us. She's a very strong-willed person who's become an advocate for people with cancer. We've gone to visit our elected representatives with her, and she's educated our legislators in Washington. You've been on certainly more morning shows than any of the rest of us have been on, talking about her cancer experience. And I met her when my colleague from Toronto, probably the biggest center for sarcomas in Canada is in Toronto, and my colleague up there, Jay Wunder, called me and said, Mike, this one is so big, I think I might be able to get around it. I can't imagine we could put it back together. I know you guys have a team, so one of the things you've heard again and again here is the strength of the team. Well, I'll let you say to them whether it worked well or not, but it worked, and she's now without a cancer and has a very active, functional life. Also become a celebrity. She's been on TV. And I have to acknowledge when they called me about this show they wanted to put her on, and they said, well, you know, we're going to do a story on Mrs. Ollson on an episode of Grey's Anatomy. And I said, well, what's that? That's an anatomy book I think I saw in medical school. I was unaware, completely unaware it was a TV show. But they told your story in a fashion of a TV show. So Mrs. Ollson has a lot to say to you, and thank you so much for coming. Where is your daughter?
She's up
Where is she?
here.
You want to come and sit by Mom or no? You sure? Well, thank you for coming and helping Mom travel. You were just tiny when I first met you. You're a big girl now. Janis, it's your stage.
Thank you. Can I just use this?
You can do what you want.
Yeah.
If you want to use this one, you may. If you want to use that one, you may.
I think it'll be easier.
I'll get that out so it doesn't get any feedback.
And then
And if you want to switch to this one, just let me know and I'll bring it up for you.
I think that'll be okay if it's not right in my face. So again, my name is Janis, and I thank you for having me here today. Thank you, Dr. Uzemski, for inviting me to speak to you. I see Dr. Sim has snuck out. I was going to make a comment that I am up from Canada, which he always calls up in God's country. He is another fellow Canadian. And this morning, he was talking and referring to one of his favorite patients, and I was waiting for my name to come up, but it wasn't me. So I am a survivor, so my presentation will be a little bit different perspective. I don't have an MD at the end of my name, so it won't be as academic as the presentations you've been hearing this morning. But what my goal is to share with you my story and my experience. So maybe you can relate somewhat. I'm sure our journeys will have similarities, and speak a little bit more in detail about diagnosis and treatment. And then more than anything, what's important to me is what life can be like after treatment. So that's my intent for today. This morning, Dr. Delaney was talking about patients' lives and looking at not just where you're at right now and making the decisions regarding treatment, but what your life can be like, you know, long-term and quality of life. And so that's something that I want to touch on. So I'm going to try and put my story into a 5-minute story just so you can gain an appreciation of where I'm coming from. And then, like I said, I'll go into a little bit more detail about diagnosis, treatment, and life after treatment. So this is where I'm going to start my story. I was about 25 years old in this picture. This is a picture of me and my husband, Daryl. By this point, we had been married for approximately 4 years and decided we wanted to start a family. So I became pregnant with my first child, which is my daughter here that's in the front row. And I noticed during this pregnancy that I was having back pain. In all reality, I was probably having back pain even before the pregnancy, which my first mistake was ignoring it. And I just thought that, can we just snooze that? Okay. We just thought that it was related to the pregnancy. Prior to the pregnancy, I just figured it was, normal health things. Lots of people have sore backs, and I ignored it. But during the pregnancy with Braxton, it started to get worse. But it wasn't unbearable. I could still go on with my daily routines, and both myself and my medical professionals at that time thought that it was pregnancy related, so we weren't looking too much into it. And then in 2004, I gave birth to her, and it seemed that after giving birth to her, the pain subsided somewhat. So that supported the idea that it probably had to do with the pregnancy. And so I continued to, go about my life, and I did have continual pain, but again, it wasn't overly affecting my daily routine. I was seeing a chiropractor, I was seeing a physiotherapist, because we all thought now that because I had given birth, the back pain was probably associated with that, and things move and shift, and so we were trying to deal with that, but it wasn't too bad at that point. But 2 years later, we decided to extend our family again, and I got pregnant with my son, who is now 9. And with that pregnancy, the pain got really bad really quick. By the time I was 3 months pregnant with him, I was already waddling. And for many moms in the room, when you're 3 months pregnant, your baby's about the size of a pea, so it shouldn't be causing that much back pain that you would be waddling. And by 5 months pregnant, I was no longer working. I couldn't sit at a desk for long periods of time. And by 7 months pregnant, it was absolutely unbearable. I was receiving pain treatment because my doctors at the time, again, thought it was due to the pregnancy. They thought it was pregnancy sciatica. So I had some pain management, but by 7 months pregnant, it wasn't working at all. I wasn't sleeping. So the night that I eventually admitted myself to the hospital, and the night that I did, I hadn't slept 1 minute. I had tried, sleeping on the bed, on the floor, on the couch, sitting up at the kitchen table, heat packs, ice packs, TENS machines. I had everything that I could safely use during pregnancy at home, and it just wasn't working anymore. And so that's how I ended up in the hospital, and that's when they discovered that it wasn't the pregnancy. They had done an MRI and realized that there was a tumor there instead. There wasn't much we could do at that point because I was pregnant, so I couldn't go through most of the typical, I couldn't have an x-ray or anything like that, so we had to wait until my son was born. And so he was born premature, 6 weeks. And at that point, then we really started to kind of have a look at this and what it is and what we're going to do. And like Dr. Uzemski said, I was sent to Toronto, which is where Canada's sarcoma specialists are. And from there, they referred me down here to the Mayo Clinic to see Dr. Uzemski. And so this is where I had my surgery. And at the time, it was a pretty groundbreaking surgery. It was risky and novel, but it was a success, and I'll get more into that a little bit later. But that is more or less, I'm not paying attention. So this was the little guy that was born premature. And this was a picture of me when we were down here at Mayo having the surgery. And so that was kind of my story in 5 minutes to honestly get a good grasp on the particulars of what I went through. I'd probably need to bend your ear for a couple hours, but that's kind of a general story of where I'm coming to you from today. So now I just wanted to focus a little bit more on the diagnosis and the treatment. So as far as diagnosis, this red box is more or less where my tumor was. You can see it says ileum there. My tumor was a chondrosarcoma, so it wasn't a a chordoma, but it was very similar. It started in the chondrocyte, so that those are the cells of the cartilage. So it was in the iliac joint that it started, but by the time we found it, it was very large, and it had spread to the soft tissue, the bone, and it was in the sacrum and lower spine. So it was in that whole general area. And treatment-wise, very similar as well. There aren't many options. Surgery is your best option, and if you can get clear margins, that's how you're going to survive this cancer. Radiation and chemo aren't used at all, or in my case, weren't used. I just want to make sure I'm not forgetting anything. So this was my situation, and when I was first diagnosed, it was when I was in the hospital, when I admitted myself there when I was 7 months pregnant. So that was at home in Winnipeg, Manitoba. And I still remember when they first told me that I had cancer. I knew very little. I was quite young. I was in my late 20s. I knew very little about cancer, and she used the word sarcoma. And I almost feel bad for my OBGYN because it's like she had to tell me twice. I could see the pain in her face, but when she said sarcoma, I didn't have a hot clue what she was talking about. So then she had to use the word cancer. And when she said cancer, my brain, I'm a bit of an internal optimist, so my brain automatically went to tumor. And I knew that there was two different types of tumor, a benign tumor and malignant tumor. And so I automatically thought it must be a benign tumor she's talking about. I must have a lump, and we'll have to deal with that. And I think that attitude, like that, being an optimist, thinking positive, not worrying about all the bad stuff, that definitely served me well over the period of years that I dealt with this. Earlier, Dr. Sood was talking about, how your brain works, and if you hear something bad, you really want to dig in. I don't think my brain works quite right then, because that really wasn't something I wanted to do. I really did focus on the positives. So when I was told that, that's initially what I was thinking, and they clarified pretty quickly that no, it wasn't a benign tumor. It was a cancer. But at the time, now we're going back about 10 years, so I didn't have a smartphone, I didn't have a tablet, I was in the hospital, so I didn't have access to a lot of information. And I think for my own peace of mind, because I was pregnant, my doctors probably didn't give me too much information. And also, because we hadn't done a biopsy or anything, they probably didn't have too much information to give me. But I think all of that was good. I think sometimes the internet can be your best friend and your worst enemy. So I caution you with that as well. If you're doing some research online, that you make sure that you're going to reputable sources like the Mayo Clinic or the Chordoma Foundation, because a lot of the information that's out there can be very biased and it can be very negative, and that can really affect your perception and your attitude. So at that point, I was in shock, but I was still an optimist. I was still thinking that, well, it's cancer, but I hear a lot of people have cancer and a lot of people are surviving cancer. So, we'll probably have to do some chemotherapy or something like that, and we'll be fine. And I didn't worry about it too much. Again, I was pregnant. I was really looking forward to that baby. So I was really focusing on that and making sure he was okay and we were going to get him home safely. And I didn't worry too much about the diagnosis or the cancer until I went to Toronto. After my son was born, then they sent me to Toronto for another biopsy because the first one was inconclusive. And it was there that he really laid it out on the table and, told me what chondrosarcoma is all about and what are the treatment options or lack thereof. And he was very honest and said, like Dr. Yuzemski said, he believes he could take me apart, but he wasn't so sure that he could put me back together. And told me that if we were going to get rid of this, it was probably going to require something this major where I was going to lose my leg. And, that's when everything kind of started to fall apart. And to this day, I can still remember, that feeling in Winnipeg, hearing that I had cancer. That was kind of general shock. But in Toronto, when he really laid it out on the line, it was completely different. The way that I describe it is that my brain really didn't have a schema for what that emotion was that I'd was feeling. I'd never felt anything like that before. So, if you're happy, your brain knows, you smile and you have certain actions. If you're sad, you cry. And with this emotion, my brain just didn't know what to do with it. I felt like I needed to get up. I needed to sit down. I was hot. I was cold. I thought I was going to throw up. I just didn't know how to process that information. So that took a little while. So I just want you to know that, there's other people that have been there and that understand that part and know what that feeling feels like. And I understand that it can be scary and very glum. But I can also tell you that the journey, kind of at the end of the rainbow, it can be wonderful and it can be amazing. And that's what hopefully I'm going to share with you as I go on here a little bit. So that was how I ended up at the Mayo Clinic. And so the first time that I spoke to Dr. Uzemski, it was over the phone. And by that time, he had had a look at my case and they had kind of come up with a plan for me. And this plan involved a surgery that had never been done before. It was something that they had come up with and tried in the lab, but it had never been tried on a human that was alive before. And so I was going to be that girl. And we had that conversation and we talked about all the deficits that come with surgery in the sacrum and all the issues that I was going to have to face long term. And I remember him saying to me at the end of this conversation, obviously this is a lot for you to take in and a lot for you to ingest, but if you want to take some time and speak with your husband and your family and decide what you want to do and get back to me, if you're wanting to do the surgery, we can do it this date or we can do it this date. And at that point, I didn't want to prolong it anymore. It was bothering me that I knew I had a cancer inside me and it was growing and we weren't doing anything about it. So in that conversation, before he even hung up, I said, no, we don't need any time to think about it. This is what we're going to do. And in my eyes, I wasn't looking at it with all the negatives and, you're going to lose this function and be in a wheelchair and all of that. I was looking at it as I'd finally found somebody that had a plan to save my life and had a cure or a treatment for me. So again, that just reinforces the attitude and what I think really helped get me through it. So my advice, if you are in a similar position and you've had the same kind of dramatic news and you're looking at a long hard road in front of you, that you're right, it probably is going to be a long hard road, but I would find something, and this is what I did, find something that you're willing to die for. We say we jump in front of a bus for that person, or maybe it's a goal or aspiration, something you've really been working towards, or you want to see your grandchildren grow and be alive and present in their life, whatever it is, something that you say you would die for, and instead turn that into I would live for. And keep that your focus, that you're not going to worry about all these little things. You're going to live for that, whatever that takes. And that's where I was at. I had a 2.5-year-old, I had a newborn, and I wasn't worried about all the little things and all the complications. I knew they would, they were obviously compatible with life, or Dr. Uzemski wouldn't have offered me that solution. So I was going to worry about that a little later. What I needed to do first was fight for them and be present for them. And the second thing that I would encourage you to do is to seek information and to seek good information. So I think you're all in the right place. You've come to the Chordoma Foundation, you've come to the Mayo Clinic, and I think you're definitely on the right path there. Make sure that you are speaking to the right people and getting the right information, that you're asking a lot of questions. That's something that I probably didn't do enough of. And I understand that, the Mayo Clinic or this center may not be right for everybody, but there definitely are a lot of good, reputable, professional organizations, and that's where you want to align yourself with. And so moving more into the treatment. So my treatment, like I said, was here at the Mayo Clinic. And what the thing was that brought me here and what the big difference was is, like I said, it wasn't the removing of the tumor, but it was life after. It was that multidisciplinary team that was going to look at what would I be left with afterward and how would I be able to survive afterward. And when you have a tumor that's that big right in the middle of your body, it's one thing to take the tumor out, but you're left with a hole in the middle of your body. And in my case, it's okay, it's not like I had too much up there. But in my case, because we had to remove, what we ended up doing is having a hemipelvectomy and a sacrectomy. So hemi for half, pelvic for pelvis, ectomy for removal. So we remove half of the pelvis, and then sacrectomy for sacrum removal. And so we removed the entire sacrum. And so that left a disconnect between my spine. The lower part was then removed, and then I had still half of a pelvis and a leg, but they were no longer connected. So that was the really groundbreaking surgery that happened here, is that they ended up figuring out how they were going to put me back together and make that work. And I know I'm not really good at explaining that. So what I'm going to do is show you a quick film here. It's only about 3 minutes long. It was done here at the Mayo Clinic in their Medical Edge department, and it'll show the reconstruction. So it'll be a better visual than me trying to explain it.
Janis Ollson thought she had it all. She was young, in a great marriage with baby number 2 on the way. Then she got the bad news. A rare cancer had formed in her pelvis. Getting rid of the cancer would mean not only removing part of her pelvis, but also part of her spine and her entire left leg. For treatment, Janis went to Mayo Clinic, where doctors performed a first-ever reconstructive operation in hopes that she would walk again. Janis Ollson first noticed the pain when she was 32 weeks pregnant with her second child.
Pretty cruel, pretty brutal pain. It started out like, I guess, what probably a lot of people have in pregnancy, but it got worse very, very quickly.
The pain was caused by a cancerous tumor in her pelvis called a chondrosarcoma. Surgery was Janis' only option, but to save her life, Janis would have to lose a lot, part of her pelvis and her left leg, and there was no guarantee her remaining leg would function normally.
Their goal was, for me to survive, to see my babies grow.
But Janis wanted to do more than just survive. Her family went from their home in Canada to Mayo Clinic in Rochester, Minnesota. There, a team led by Dr. Michael Yazemski removed the tumor and performed a first-ever pelvic reconstruction in hopes that Janis would walk again.
My colleagues and I went to the anatomy lab and designed this reconstruction, and she was the first person we tried it on.
The procedure was done in 2 different operations. During the first operation, Dr. Yazemski and his team removed Janis' left leg, half of her pelvis where the tumor was located, her tailbone, and part of her lower spine. In the second operation, they took the top portion of the leg that was removed, rotated it, and secured it to her pelvis. Then they shifted her right leg and remaining pelvis and secured it to her spine. The reconstruction allowed Janis to maintain function of her right leg. It also provided a foundation for the possibility of a prosthetic left leg. Janis' husband Daryl remembers the first words Janis spoke.
And she asked me if she was dying. And I said, nope. It was a complete success.
Recovery takes time.
I'm in the wheelchair most of the time when I'm at home.
But Janis is learning to walk with crutches and is not letting her physical limitations slow her down.
I'm driving, so that's a sign of my rehabilitation.
Every day, Janis says she's getting better, stronger, and she's looking forward to a long and fulfilling life with her family. Janis continues to be cancer-free. She's proud to have been the first person to benefit from this reconstructive surgery, and she hopes her experience will help others in the same situation walk again. For Medical Edge, I'm Vivian Williams.
So that, I'll let them get me back to my slides. That is not something that I would have been able to do justice. So that gives a brief idea of what the surgery was like, and it obviously wasn't a surgery for the faint of heart. It was a huge commitment on my part and my family's, as well as the team here at Mayo, and they've been following me ever since. Miss Beck this morning was talking about the messy pain, and I thought that was it was a pretty accurate acronym for my life, because I've probably been affected by everything that was on that list to some degree. But it's, again, something that I don't focus on. Everything that is on that list is manageable, and I'm 9 years out, and it's not really something I think of every day. Like, those management things are just things you get used to, like everything else you got used to when you were little and learning how to take care of yourself. And they're not things that I focus on. They're not things that I would change my decision. Like 9 years later, if I could go back in time, I would never say, oh no, this was the wrong decision. I'd do it differently this time. So like I said, if you're on that journey, I can understand where you're coming from. And a couple more pieces of advice, again, are just to ask lots of questions. Try not to make assumptions, because I know we all do, and I made a lot of assumptions that were not accurate. So I would suggest that you write down your assumptions as well as any of your questions, and then find the right people to answer them, like people that have either been through it before or medical professionals, and seek more than one if you can. If you know it's going to affect you in one area, then go see a professional in that area, and make sure you talk about your quality of life down the road and what that looks like for you, because these aren't situations where you want a generalist dealing with you. You want to come to a center such as this that treats your entire being. And that's one thing that I found at Mayo, is it wasn't just about my cancer and how we were going to remove it. It was about me as a person. It was about my family. My family moved down from Canada for 2 months and lived in a hotel here, and the Mayo did everything they could to be accommodating. It's the little things too that make a difference. Dr. Uzemski, after 20 hours of surgery, rather than going home to his wife because he was exhausted, he picked up the phone and called my husband, and told him that the surgery is over and everything went well, and gave him all the answers that he needed at that time, so that he could maybe get a couple hours of sleep. My daughter at the time was 2 years old, so I was very concerned about how I was going to deal with that and explain it to her. And the Mayo Clinic gave me this little doll, which she very colorfully decorated. But it was a doll with one leg, and they gave me that and explained to me how I could discuss it with her so she could understand some of the changes that Mom would be going through. They let my dog come and visit me, which was a really big thing. That was wonderful therapy for me. Even something as small as stitches. I had 144 staples, not stitches. And so when it was time for those to come out, I remember being very nervous, because every morning the orthopedic gentlemen would come in, and they were good at what they do, but they weren't always the most gentle folk. And so, they would come in and they'd roll me over and they'd look at what they needed to look at and they'd leave. And if you've ever seen Dr. Uzemski's hands, they're about this big. And I could just picture him coming in and removing these staples, like flick, 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 flick. And I was so worried about that. And I remember asking one of the orthopedic doctors if, when that time came, if the nurses could take out my staples. The nurses, you spend a lot more time with, and my theory was they had more time because they're on the unit all the time, and if I got sore, if I got upset, that they could stop and we could leave it alone for a little while and they could come back. And I think he might have been the slightest bit offended, but in the end it was no problem, and the nurses took out my staples and there was no problem with it. But it was just those little things that meant a lot to me and my family in treating the entire person. So I know I'm out of time here, so I'm just going to quickly flip through a couple of pictures, because this is what's most important, is life after surgery and some of the things that I've been doing. So this was an ad for the Mayo Clinic that I was lucky enough to do. I've done a handful of things with the Mayo Clinic, like Dr. Uzemski said. I joined their team and went to Washington, D.C. and had some wonderful experiences there advocating for research and health dollars to be going in the right place. I've definitely had my 15 minutes of fame with it, but I also do other things. I've met a lot of other people that are going through similar situations, and I've been able to be a mentor to them. Here, I was speaking at a school in Canada. Terry Fox is one of our big Canadian heroes, and it's a huge foundation for cancer research. So around that time of year, I often go to schools and I speak about my experiences and what that means. Here's us on the Rachel Ray Show. We did get to go on the Rachel Ray Show and the Today Show and share our experiences there. So that was fun times. One of my concerns after was how I was going to keep active, and that wasn't something that I was really sure how I would do. In the beginning, part of those assumptions was I kind of saw myself as like a clock up on the wall. You know, I'd still be alive, I'd still be ticking, but I would be watching. I'd be watching other people's lives, but I'd at least be present, and I was okay with that. But I didn't realize that wasn't at all what my life would be like. And so this is me playing hockey. It's an adapted sport called sledge hockey, and here I'm actually teaching a group of students how to play. This isn't the most flattering picture, but this just shows my stubbornness, because this is me kneeboarding. And as you can imagine, with one knee, it's pretty hard to kneeboard because you need that balance. And my husband, which should know better, continued to tell me that, like, you can't do that. That's just not something you're going to be able to do. And which just drives me even more to make sure I figure out a way to do it. And so I did figure out how to do it. And I'm going to lay claim to inventing a new sport too, because for me, it's elbow boarding. I just don't go up on my knees. I stay on my elbows, and that's how I balance. But I do stay active. This is a picture of me and my husband. We coach soccer. I'm also the soccer convener in our town. I'm currently a university student. I just finished my Bachelor of Science and my Bachelor of Education. I'll be finishing this spring. So I'm in the school student teaching right now. And then, of course, you know, in the beginning, this is what it was all about, and every day, and in the end, this is what it'll be about, is that I'm with my family, I'm active, I'm having fun. The experiences that I've had in the last 9 years, I would have never had I not had the surgery. So it's not something that I regret. I'm still ambulatory, I still get around, and so I hope that, you know, if nothing else, it gives you a little bit of inspiration that if you're on the beginning of your journey, that it can be hard, but at the end of the rainbow, you know, it can still be wonderful. So that's it. I'm sorry I'm over time. If anybody has any questions, I'd be happy to answer.